Good morning. We would like to acknowledge that we are coast to coast on First Nations, ancestral, and unceded territories. Specifically, the lands on which we gather today are the ancestral lands of Anishinaabeg, Cree, Oji Cree, Dakota, and Dene peoples, as well as the homeland of the Red River Métis. We respect the treaties that were made on these territories, and we're committed to gaining knowledge, forging a culturally safe relationship, and contributing to reconciliation and collaboration.
Okay. So for anyone who doesn't know me, my name is NATASHA PARDY, and I'm the current president of the Association of Hemophilia Clinic Directors of Canada. And I have been given the task of welcoming everyone here to the Rendez-vous for 2025, and I'm so pleased to be doing this, and welcome to everyone. So first off, I just want to thank the Canadian Hemophilia Society for hosting Rendez-vous every couple years. It's such a wonderful opportunity for our community. I want to thank the City of Winnipeg and the Fort Garry Hotel for the warm welcome. I also want to thank the organizing committee. So in my past role as Vice President of AHCDC, I led the committee to organize the AGM for the 2 years prior to this, and so I completely recognize what a huge task it is. So kudos to the organizing committee for putting this together. And finally, I want to thank all of you for coming, and I think this is the really important thing I wanted to say. I want to thank everyone in this room for your dedication, your enthusiasm year after year. It speaks volumes, not only of our Canadian community, but also the role of the bleeding disorders community within medicine, and as a community in medicine. So recently, and I know she's in this room, I was speaking to Angela, who just stepped into a new role at Roche, and I was very excited for her, and I was, trying to convey to her what a wonderful opportunity it was that she was moving into the bleeding disorders field and getting to work with this community. And the reason what I talked to her about in that excitement was, this is such a unique community because everybody has a seat at the table. So we have patients, physicians, nursing, physio, social work, pharmacy, CBS, government, advocacy groups. Everybody has a seat at the table. And industry, of course. This community is the true definition of teamwork, of shared decision-making, of honesty and respect. And I'm just so pleased to be a part of it, so excited to be a part of it, as are all of you, I'm sure. I now have the great pleasure of introducing the Canadian Hemophilia Society President, EMIL WIJNKER.
Thank you, Dr. Pardy. On behalf of the Canadian Hemophilia Society, it is with great honor that I welcome you all to Rendez-vous 2025 here in Winnipeg. Let me please take a moment to thank the Manitoba chapter, who incidentally is celebrating their 60th anniversary this year. So congratulations. Thank you for your welcoming the Canadian bleeding disorder community so graciously. In what has become a biannual tradition, we come together as a patient organization and join forces with our 4 healthcare provider associations: the Association of Hemophilia Clinic Directors of Canada, the Canadian Association of Nurses in Hemophilia Care, the Canadian Physiotherapists in Hemophilia Care, and the Canadian Social Workers in Hemophilia Care to present to you a program which includes the most up-to-date medical and scientific knowledge from our bleeding disorder experts. This weekend would not be complete without the opportunity to hear from each other through the community workshops and social gatherings. We also welcome our partners from the pharmaceutical industry. Their contributions to the advancement of our care through research and treatment accessibility are tremendous. Rendez-vous would simply not be possible without their unwavering support. So thank you to our presenting sponsor, Roche. Our innovator sponsors, CSL Behring, Novo Nordisk, Pfizer, and Sanofi. Our champion sponsor, Regeneron, and our supporting sponsors, Bayer, Octapharma, and Star Therapeutics. Thank you. I would now like to invite Lisa Peterman, Chief Patient Experience Officer at Roche Canada, to come up to say a few words.
Thanks, Emile. Bonjour tout le monde. I am delighted to be here on behalf of Roche Canada to welcome you to Rendez-vous 2025. Most of you are wondering, what is the Chief Patient Experience Officer? That's the #1 question that I get in my role, which is a brand new role. And it is unique in industry in that in order to qualify for my role, I needed to have a minimum of 10 years of lived experience as either a patient or a caregiver. So in my capacity, I sit on the senior leadership team for Roche Canada, looking at the pharmaceutical side of things, but also with the diagnostics group, product development, analytics and insights. And so what we're endeavoring to do is bring the voice of people with lived experience into every decision-making table that we have at Roche Canada, which makes the opportunity to be here with you absolutely thrilling. And so I don't know anyone here. They were nice enough to have a fellow Newfoundlander up here to get me started. And I met a lovely woman who was having an elevator problem with me this morning. So I'm off to a great start in terms of collaboration. But if I could ask that, please come and find me. Please take time. I am here to listen and to learn and to bring your wisdom and your insights back into our organization so that we can truly do now what patients need next by being informed by each of you. And with that, I would like to invite Nancy and Julia to come up to the stage. I see one is supporting a very appropriate jersey. And so please join me in welcoming them. Yes.
The height. There we go.
Stand on your tippy toes.
I'm used to doing that. Good morning, everyone, and welcome to Winnipeg for Rendez-vous 2025.
Bonjour tout le monde et bienvenue à Winnipeg.
Hello, everyone. Welcome to Winnipeg for Rendez-vous 2025. Just a reminder that interpretation services are available in French. We ask that you go and get your headset at the desk at the back of the room if you need it.
Dr. PARDY, EMIL WIJNKER, and Lisa Petermann for kicking off the day, and to Sarah Ford for the land acknowledgement. We are excited to be here, Julia and myself, as your MCs today. I am Nancy Hodgson, a nurse coordinator and research nurse at the Saskatchewan Bleeding Disorders Program. I myself struggle with my own province's name. I have over 16 years of experience in bleeding disorders care, and I've been continuously excited by the advancements in the care of all those living with a bleeding disorder.
And as been mentioned, my name is Julia Brooks, and I'm a physiotherapist at the Alberta Children's Hospital in Calgary. I've worked in hemophilia care for more than 20 years. I was born and raised in Winnipeg. Yes, clap, that's a good one, yeah. And I got my start in hemophilia care at the Winnipeg Children's Hospital. So this is where my heart is. Go Jets, Game 6, we got this.
For my Ontario colleagues, go Leafs, go. Okay. Now, this year, the title of our scientific symposium is To Infinity and Beyond, a challenging world of bleeding disorders care. This is truly a time of rapid change and innovation in the bleeding disorders world, and we know we can continue to do better.
Looking back at the 2023 Rendezvous held in Niagara Falls, sessions covered a range of important topics, including innovative coagulation therapies, women in bleeding disorders, mild hemophilia, and concluded with a session on gene therapy, managing expectations.
This year, we are excited to present even more incredible topics shaped by your valuable feedback from past events. Session 1 will take us along beyond hemophilia, diving into bleeding disorders with presentations on rare clotting factor deficiencies, von Willebrand disease, and acquired hemophilia A.
Session 2 will focus on reproductive health and sexuality, exploring family planning, genetic counseling, sexual health, and hormonal therapy for patients with bleeding disorders.
Session 3 will look at bleeding disorders throughout the lifespan. I highly recommend you come to that one. I might be on the panel. And with a panel discussion on aging with bleeding disorder, mental health literacy, and more.
Finally, Session 4 will round out the day with discussions on new frontiers in hemophilia treatment joint health with non-factor therapies and a patient perspective on novel therapies.
We would also like to extend a special thank you to the Planning Committee on their hard work in putting this event together. Their dedication and effort has truly made this possible, and we are incredibly grateful for all their contributions.
So before we get this kicked off, just a few housekeeping items. Please make sure to return to the sessions promptly after the breaks and lunch when you hear the bell. This will help keep us on track because we all know we love to talk to each other and we love to talk about different things on the screen, and that often delays us returning. Bathrooms are out the door to the right. You can go up the stairs, or there's an elevator that's hidden behind a curtain just past the booth, and that will take you up to the bathrooms up there as well. Now, for all our presenters, please don't panic. When some of the slides were sent in, some of the fonts changed, but your slides are all intact. They just might look slightly differently, and the AV team has done a great job of just trying to make sure they still look okay. So no panicking when you see your slides look a little bit different than what you were expecting.
Now it's with my pleasure to introduce Dr. Lee and Heather Bowman, the chairs for Session 1, who will be kicking off with our first speakers.
Please join us in welcoming them to the stage. Thank you again for being here, and hope you all enjoy the symposium.